want to give a lot of thanks to the Startup Health crew. It's amazing what they've done, so thanks. I also want to thank Dr. Michelle Blackmore, who's sitting next to me. She's the director of Montefiore Health System's Behavioral Health Integration Program, and she's really doing God's work in the Bronx, serving over 700,000 patients. Before I jump over to Dr. Blackmore's story, I want to share a little bit about Valera Health. So we're a startup company, and we're amplifying human interactions for behavioral health conditions using data science and technology. And for the last, I would say, 30 years, suicide rates have been increasing. 50,000 patients committed suicide 2016. 2018 was a huge wake-up call with the loss of Anthony Bourdain and Kate Spade. But countless unnamed Americans are suffering with depression, loneliness, opioid recovery. And this is what we're trying to do in terms of solving the moonshot. We're trying to serve 25 million Americans over the next few years. A little bit about our journey. So many years ago, I was an intern in a primary care residency program, and I was post-call. I was probably up about 24 hours. This is way before the 80-hour work week rule. So I was up for about 24 hours, post-call in the CCU. I did my residency in New York City, so my parents wanted to meet up for dim sum. I drove all the way down to Chinatown, and just like any other set of parents, they started talking about marriage. And they said, in Chinese, they said, all right, it's time for you to think about meeting someone. We want to fix you up with Sophia, the doctor. And in my state of fugue, I blurted out, I'm actually dating Matt, the dentist. So, to their horror, my mom in the dim sum place started spewing things that I can't really say on stage in Chinese. But essentially, she said, it would have been better you've been a drug addict, and you're an abomination. So subsequent to that dim sum meeting, over the course of several weeks, one would call what I had reactive depression. And that included contemplating suicide. Now, as a physician, I had nowhere to go, and I didn't know who to go. It was a challenge. This is back in the 90s. Ultimately, I ended up talking to my program director in internal medicine, and who connected me with a psychiatrist. But looking back, it was a horrible experience. The psychiatrist kept on wanting me to come back for therapy, and I had no end in sight. Was I just paying for his mortgage? There was no measurement. There was no blood test. There was no MRI. So how do we define how I felt? So moving forward 20 years, we now have the capability of leveraging data science and really using technology to amplify the care that we can receive and actually measure outcomes and actually connect with patients at their own terms in the comfort of their home or in the privacy, but yet at the same time, give them the information that they need. So with that, I'm going to turn it over to Dr. Blackmore.
Thank you, Tom. And I want to thank you for sharing such a personal experience. I think that story really highlights how many of us are impacted by mental health conditions. We know there's a healthcare crisis, but unfortunately access severely limited, especially to quality care. And just not enough providers, not enough resources. We've seen this firsthand at Montefiore Medical Center in the Bronx, and what we have done to address this is a little bit of what I want to discuss today. So a lot of our patients frequently come into the hospital through the primary care physician. They are already overburdened. And so if they have mental health needs, the primary care physician doesn't have necessarily the resources to address it. We decided to hire a number of mental health coaches to help support the PCPs and the patients that they see. Very quickly realized that wasn't enough given the great need that we were identifying. So we started looking for a technology solution and vetted a number of technology vendors, but it really was Valera that could help us meet our patient needs, cost-efficient manner, limited burden on our staff, and improve, this was key for us, improve the patient-clinician relationship. That's what we were looking for. So I think the best way to illustrate this is through a case story, patient story, that I want to share with you. We had a patient, Giselle, coming to see us through a primary care physician, 43-year-old, mother of 5, working 2 jobs. And her PCP referred her to us because of chronic depression and anxiety and frequent suicidal thinking. Giselle was very motivated for treatment, but realistically, 5 kids, 2 jobs, was able to come maybe once or twice every couple of months for visits. Definitely not enough to make any kind of meaningful improvement in her treatment. So we introduced her to the Valera Smartphone App. And with that, the smartphone app, it didn't replace the face-to-face visits that Giselle had with us, but it extended treatment beyond the 4 walls of the office setting. It allowed Giselle to essentially have 24-hour access to tools and strategies to help monitor her, better manage her mood, improve ways of managing her day-to-day functioning, and it gave her easier access to us as her behavioral health team. We found that one of the key aspects of Valera that was particularly helpful for Giselle was that it allows us to essentially have kind of a GPS for depression and anxiety. It allows us to monitor through geolocation and step count if a patient is inactive. So this is frequently a sign that patients are experiencing an increase in depressive symptoms. And the app will alert us if a patient is becoming less active. This proved potentially life-saving for Giselle at one point when our team was alerted that Giselle hadn't left home for about 72 hours, which is really unlike her. We were alerted. The team reached out immediately. Giselle told us that she was experiencing increased suicidal ideation, was not able to get out of bed, and we were able to intervene right then and there. We could provide her some management strategies to help better manage her mood and some crisis management techniques that she could use. We set her up for an appointment the very next day. And just speaking as a clinical psychologist, I think this is crucial feature of the app because it shows that we're able to provide kind of a continuous safety net of support for our patients. Giselle also reported that the application helped her to feel more empowered over her health care. She was able to monitor her treatment plan goals, monitor her progress, and at one point noted to her behavioral health coach that she felt more motivated, safe, and cared for by her care team by utilizing this application. And I think that's really key because you often hear this fear about technology being too technical and impersonal, but really through this technology we were able to provide our patient with a sense of additional support from the care team, not so impersonal. The other, I think, key aspect of the app is that I actually said that it really enabled Giselle to feel empowered. Why I think this is so key is because ultimately this type of technology really addresses that issue that we're talking about limited access, quality, and consistency of care. It improves that without requiring much in terms of additional time and resources from an already overburdened provider staff. So this is key for us. Makes it feasible to actually implement and help the patients feel more connected to their team. So because of some of the outcomes that we've seen, we've expanded Valera throughout our hospital system. We've also expanded it to some of the partners that, some of the practices we partner with throughout New York State. We're excited to report that we've served about a little under 2,000 patients at this point using the technology, and look forward to expanding from this point on. With that, I'll turn it back over to Tom.
Thanks, Michelle. Again, I really, really applaud you for doing God's work in the Bronx, and thanks for sharing with us about Giselle. So we're proud to say that by this year, we've reached 1 million contracted lives, and we're well on our way to our moonshot, sorry. Thanks, Michelle. Having a fugue right now. Behind me are some of our partners, and we're really proud to announce that in 2019 we're moving on to our next phase, which is to offer clinical services. So we'll be developing our own clinical team across regions and markets, as well as coaches and psychiatrists. For the last 20 years, I've been really fortunate and blessed to be involved with projects where I could change the ecosystem. Amongst them being a congressional staffer on the Ways and Means Committee. I was part of the team that developed the ACA. And then I worked for the Obama administration rolling out aspects of the ACA. But I'm really, really proudest of Valera Health and the work that we've been doing. So come join me in sharing this journey and helping us achieve our moonshot. Thank you.